Welcome to Lytchett Minster School. This is the Hustings for Mid-Dorset and North Poole, which we're delighted to host. Absolutely delighted that Candice Johnson Cole could be with us for Labour. Delighted also that Vikki Slade could be here for Liberal Democrats. We are expecting Ben Pantling from Greens, but inexplicably he has not appeared. And obviously we're sorry that Michael Tomlinson couldn't make it this evening. Thank you so much for coming this evening. What we thought we'd do initially is just to invite the candidates just to say just a few words, just to introduce themselves a little bit, and I have said keep it nice and short to allow more time for questions. So they'll introduce themselves. We did say if you've got questions, perhaps send some in advance, and some people have sent a few questions, so we'll start with those. There's just a sort of 3 or 4 that we'll try, and invite the person asking the question to come to the front, if that's all right. And then there will be an opportunity. We have a roving mic, so there we go. So if you wanted a follow-up question on that topic, that's fine. If you just raise your hand, and Andy will come running to you. Is that all right? So if I could start, perhaps Candice, would you just like to introduce yourself a little bit to everyone? Thank you.
Sure, no problem. Oh, do you want to stand or?
I don't think so.
Well, good evening, everyone. My name's Candice Johnson Cole. And after 23 years of living in mid-Dorset and Poole, I've decided to throw my hat in the ring and campaign to be the Labour Party candidate for the next general election. Just a little bit of background about myself. I started my working life in retail and public relations. I then went on to work within the community in ex-mining towns in Doncaster. I then returned to London to work as an events manager for the Labour Party in the run-up to the 1997 general election. After that, I worked back in the community, but in Poole, in Dorset, and also in Bournemouth. And alongside that, I worked as a political consultant in Westminster. So I was doing that for 27 years. So 27 years in Westminster. Now, the people of Mid-Dorset and North Poole, all of us, we are clear that we are all ready for change. And it would be a complete honour to be the MP for Mid-Dorset and North Poole. Also an honour to be a local Labour Party MP within Mid-Dorset and North Poole. So that's me, and it's absolutely fantastic that you've all come out this evening, and I hope you have a good night. Thank you.
Thank you. Vikki.
Thanks, Andrew. Hi, I'm Vikki Slade. I'm the Liberal Democrat candidate for the general election for Mid-Dorset and North Poole. Some of you will recognise my name and face because I have been the candidate here since 2015 when we last had a Liberal Democrat MP, Annette Brooke, who retired at that election. Just a bit of background. So I moved to Broadstone, where we still live, just after we got married. We got married in 1999, moved to Poole briefly, settled in Broadstone, and we've lived there ever since. We've brought up our 4 children there, one of whom has just bought her own house, which is extremely scary. That makes me feel very old. And the youngest is now 16. We had a business on Broadstone High Street for 14 years. My background is in financial services, which I moved out of when we had our 3rd child. I realised it really, hello Ben, really wasn't feasible to be working in finance and looking after 3 children under 5. So I joined the family business, worked in the family business, which was catering and events, and then got myself involved in local politics, became a councillor, and here I am now. I've been the leader of BCP Council twice. I was leader when it was first formed of a multi-party alliance which included Labour, Green, Independents and Lib Dem councillors. and then I have become a leader again, this time of a Lib Dem Independent Alliance. Nothing against Greens and Labour. There was a deliberate decision that we felt that with a general election coming up, at that time the BCP, three parties decided it would be inappropriate for us to form an alliance and then to be fighting against each other. So they decided to stay outside. But yeah, that's me.
Thank you. Ben, it's lovely to see you. Would you like to just introduce yourself?
Firstly, apologies. The traffic's not great coming down from Birmingham today. I've been at work up there. So I'm Ben Pantling, a long-time Green Party member, activist. Stood in the local elections a few times, first time doing a general. I've supported candidates previously. Really, I'm here to make sure the Green agenda is looked at, that the environment's thought of first. As a Green Party activist, we put the environment in front of everything we do, personal business decisions. And I make sure there's the option. And we always find when there's a Green in the room, the discussion moves towards the environment. So we've made sure this election there's a Green in every room, which is the first time we've ever done it, which is brilliant. And I'm grateful that everyone's here and give me the opportunity to speak to you, and hopefully I've got some nice answers for you.
So I'd like to invite Sally Ann McCarthy to come and ask the first question this evening.
Hello, welcome. We'd just like to ask, what would you do to help tackle and prevent the rise of violent crime amongst young people? And I'm thinking specifically in this area about the worrying rise in county lines.
Vikki, would you like to start us off?
Yeah, of course. So, I mean, we've had some really tragic cases recently involving, drugs and knives particularly, and there is a real close link between county lines and both of those things. I don't know whether you've seen the incredible play The Wasp's Nest. I don't know if you had it here, Andrew. Amazing. I was totally blown away when I saw it. And I think that they're so interwoven. You know, the idea that a child would just pick up a knife without anything else is quite a bizarre thing, but it does happen. So we have to do a number of things to deal with young people's violent crime. And the first thing we need to do is to really get underneath how children are supported and what their framework around them is. So a couple of things I would suggest, so things like we need more police on the streets in our communities, not tucked away in offices doing stuff. We need an online crime agency that can deal with the online crime so it frees up our police officers on the beat. We would get rid of police and crime commissioners. We think they're a complete waste of time and money. £1.5 million in Dorset, that's about 30 police officers. So that would actually help to give the eyes and ears back into the communities. Obviously, they're dealing with that county line stuff. There's an awful lot going on online that we don't see. We need to also bring in lots more around young people. So I run a youth club. Youth clubs are a brilliant way of diverting and delaying kids getting into the wrong sort of hands. So more of the youth intervention and much more of the early intervention with social care so that we can help the professionals to get in early where there are seeds of problems within families. So those sort of general things in that. But, knife crime amongst young people is becoming a real problem because they're frightened themselves. And I think we have to help young people understand that you are much more likely to be hurt by a knife if you carry a knife. And that is going to mean taking people into schools around the country and making sure that they hear it really early. And we do need to have a zero tolerance in schools. I really do believe that because for the children's own benefit.
Candice.
Yes, I would actually concur with quite a lot of that, especially with regards to the early intervention. The Labour Party are committed to putting the community at the centre of all of our policies. We're also committed to ensuring that we have the funding to actually back up what we're actually saying with regards to those principles. One of the main things that we will be doing is putting mentors within youth custody centres and also within all schools and pupil referral units. those mentors will work with the young people and act as almost like an additional safeguarding level that will pick up on the issues and the problems that young people are having. Because what's actually happening is young people are going under the radar. They're online, nobody can see what they're doing. The issue with county lines is something that's been going on for, I would say, sort of 10 to 12 years. And that's actually been left to run its course. And the safety bill, and the Labour Party will ensure that the safety online bill will go through, and that would include the aspects of protecting young people online, but also on the streets, where we're banning the sale of knives to young people and closing those loopholes, so people don't actually have access, to knives. But what's actually happened, I would say, over the last sort of 12 to 14 years is the decimation of things like our youth services and the youth clubs. Taking away a whole level of safeguarding that we used to have. Youth workers that I speak to, say that we used to be in the front line of sort of helping the police and reporting on what was going on, and they just don't have access to young people at the moment. We have a fully funded and also costed plan to put more police on the streets, more PCSOs on the streets, so there's more of a presence, there's more of a deterrent, and also looking at the criminal justice system at the moment and speeding up the convictions of people who are involved in knife crime.
Thank you. Ben?
I agree with both the colleagues here that youth services have been decimated. There is something that, if you go back 20, 30 years, everyone knew their local youth club. I'm a big fan of youth sport. I'm a rugby coach myself, and I think it's really important to give kids things to do. There's two major aspects to county lines, especially, that haven't been addressed. One of them is poverty. You're more likely to be involved in drugs and gangs if you're in poverty yourself, and child poverty has increased exponentially over the last 14 years. So I think that certainly needs to be looked at quite seriously, and finding ways which include starting to rebuild council houses, giving people and families actually a reason to stay off, away from the drugs gangs, because they don't need the money, because it's not a desperate situation. Also, it's Green Party policy to deregulate and decriminalise drugs, because people will use drugs as people use alcohol, as people use caffeine. And at the moment, we're losing the war on drugs, and criminal gangs are in control, and it needs to be not that situation, because if the drugs aren't criminalised, then the criminal gangs can't sell the drugs, and therefore you can't have county lines, and you can't have people's lives decimated by the criminal gangs. And that's the reason why children carry the knives, because they are scared and they think that that's what they need to protect themselves. So it's a two-ended system for myself. It's removing poverty, so the temptation to deal drugs isn't there, and decriminalising drugs, so there isn't the criminality involved in those who want to take drugs.
Yes, Ben. We do have a roving mic. If anyone would like a question related to this topic, we've got a question there. Thank you.
Hello. Mr. Pantling, would you decriminalise all drugs? A, B, C, Z, the whole shebang?
Actually, yes. I think it is quite important that all drugs of all descriptions are controlled and not free in the marketplace as they currently are. There is anything you can think of you can buy in the middle of Poole, middle of Wimborne, even Wareham, if you know the right people to go to. And those people aren't the sort of people you want to really be spending time with. Drugs, as we have it, the last 30 or 40 years, we've graded them what we think is socially acceptable. So alcohol is one of the biggest costs to the NHS. It's a terrible drug if you cannot control your consumption of it, but that's perfectly legal. Cannabis has no cost to the NHS. Heroin, yeah, it's terrible for addicted user, and it has a massive impact on society. But if you choose to take that and you have a controlled substance, as you get addicts who have the methadone, they don't worry anybody else if they get their hit on a regular basis. So if the control of the drug is with an authority that can give you can buy it, and you're not stealing, you're not dealing with criminals, it will make the system better. You will remove a lot of the problems we have with youth crime because they won't be needing to sell drugs to people.
Are you happy with that? I think Judith will ask the question.
Sorry?
Happy with that?
Yes, I think that's a very naive idea, but I accept that it's your view.
Yeah, thank you. That's fine. Anyone else just on this sort of topic of particularly crime? Yes, I think it's Elaine.
I'm interested in the fact that for all of these solutions, we talk about employing new people. These people aren't really around at the moment. I know from being in the education system, in hospitals, people are not being trained or not choosing to be trained as nurses, teachers, support workers, health workers, because they don't feel as valued as people in industry, business, etc. How are you all planning to address the fact that the training is not going on, so those people that you're talking about are not actually available?
Good question. Andy, can you see?
Yes, yeah, very, very good question. There's definitely scope for improving and increasing the numbers of police officers, teachers, etc. The Labour Party, we are committed to putting 6,500 new teachers within schools. And the main way to do that is to ensure that all workers feel protected and also respected. And we'll be looking into improving working relationships for employees. At the moment, there are a lot of people who don't want to go into those professions, or they're doing the training and then going abroad, with the training. So we need to curb that and actually sit down with people and ask them and listen to the reasons why they are training in the UK and then going elsewhere. So it's definitely a listening exercise, but then we have to support the people once they are actually in those professions.
Thank you. Vikki?
Yeah, so I want to focus on the youth workers and the teaching side of it, because I think the policing, there are people joining the police service. I think one of the problems is a lot of them are coming through a graduate training programme, and therefore when they are joining, they're taking so long to be full-time officers. I understand we're back up to the number of officers we had here 15 years ago, but they're not actually working because a whole bunch of them are part-time because they're part-time studying. So it's a bit of a fantasy that we're back. But for me, the real issue here is, and there are enough youth workers, it's just that the youth services have been cut and they're all having to do something else. They want to be youth workers, but there aren't the jobs for them. We're asking teachers and people in schools to not just be teachers. We're asking them to be social workers. We're asking them to be mental health practitioners. We're asking them to be surrogate mothers and aunties and uncles. And that's not fair. So in order to actually get people back to doing teaching, which they joined because they loved, and they're leaving because they're burnt out and stressed and not valued, we need to actually get the mental health workers in all the schools. So Lib Dem policy is to have a mental health professional in every primary school, secondary school, college and university. And again, everything I'm saying that's in Lib Dem party policy is funded. You can read the funding profile behind it, so that you're not having to do that. And if you've actually got people to properly send children to talk to, and the other big element, which I'm passionate about, Andrew's heard me talk about this before, is special educational needs. Our teachers are trying to teach children who really can't manage in a class of 30 to 35 children. In every class, there will be 3 or 4 children who need some extra support, whether it's a TA sat by their side just to help them with their reading, to reassure them that they're safe, to spot when they're beginning to struggle, or whether they need to be in a separate place because they genuinely need to be in a specialist setting. They haven't got that. And the teachers can't manage to look after the 20-odd children over here who just want to get on with the curriculum, and the 4 children over here who are flipping bottles in the back, if you're lucky, or being downright disruptive, or not coping, or just really getting distressed. If we can actually help those children, those teachers can do what they love, and the other children can learn, and the children with the special educational needs have got a chance to thrive. And at the moment, they're not thriving, and our teachers are totally fed up. So special educational needs, we've got a lot of packages around what do we do about that and mental health, and I believe that teachers will start to fall back in love with their profession. But, you know, I'd like to hear from teachers about that. Should I be successful up in Westminster, I'd be really happy to talk about it.
Yeah, I agree in principle that there are people out there who are willing to be teachers and do all sorts of jobs, whether to looking after youth workers and people who like to be policemen. But we put quite a few barriers in place. One of the big barriers is the cost of education. University education is no longer free, so it becomes a burden, and it stifles the people willing to do it, because what you need in teaching, in the police force and youth workers, is people from all backgrounds and people from all social statuses. And the way our current education system works is we're not allowing those people to make the best of themselves, because the thought of 20, 30, 40,000 pound debt when you leave university really does stop people from doing it, because it's an unimaginable amount of money for lots of people. And if you understand how the system works and you pay it off out your pay, it's actually not huge amounts of money, but a lot of people don't see it like that. And Green Party policy is to remove all student fees. And I think that would enable more people to join the professions they're passionate about, rather than working in the jobs they feel they have to. Another Green Party policy is to increase the minimum wage, because I think that's one way of getting respect for some industries where people don't think that it's a worthwhile industry to go into, and nursing is one like that, where the pay doesn't really reflect what the expectation is of the person when they're there. So they're two really big things. And for me, personally, it is Green Party policy, but not one of our key ones, is universal basic income. I think if we can fund everybody to follow their dreams, you can then find people doing things they're passionate about. You won't have people working in jobs they hate because they've got to pay rent or mortgage. I think you have people who will have a passion to help children, to keep law and order. They can do that, and they can train later in life when they've realised that the education system's failed them and they've hit 25, 35, even 45, and they've now found their passion, and they can't afford to go back to university because they've got mortgages and children. Universal basic income will allow that to happen, and that will increase the workforce of the type of people we need doing the jobs that they want to, and that creates a healthier workforce if people are doing the job they want.
Thank you, Ben. Is David Howe with us? David Howe was going to ask a question related to the NHS. Would you like to come to the front, David? Thanks.
Slight problem, Andrew, because my question is addressed to the empty chair. I have, however, before this evening, written the same question to Michael, and I also have his answer. So I could, after the others have spoken, read it out if you wish, and the others would like to hear.
Not too long. Yep.
My question relates to the NHS and the promises given by the Conservative government 5 years ago. 1. What progress has been made in the building of 40 new hospitals as promised by the Prime Minister in 2019? How many new nurses have been trained of the 50,000 that the Conservative government promised by 2024? And how many newly qualified doctors are working in the NHS of the 6,000 promised in the Conservative manifesto of 2019? Now, I realise that my question is primarily aimed at the empty chair, but I'm sure the other three will be willing to give their thoughts on the matter. And if you want, at the end, it's a fairly short letter. I could give the answer that Michael gave to me, if you want.
That would be very generous to give him that opportunity. What do you think?
I mean, when I'm out on the doors talking to people, one of the top subjects is the National Health Service and waiting lists, also the lack of dentists, national health dentists in this area. I mean, people will always focus on our area, but it's a national issue, the lack of NHS dentists. And also the fact that the health service isn't very integrated. I mean, what the Labour Party will do is we will really push and introduce more integrated health centres. So you can actually visit your GP and your physio, your occupational therapist, all in the same place. So you can imagine how much time and money and how more efficient something like that would be. Also, preventative work is absolutely essential when it comes to health and the health of the nation. You know, if we will be going into schools and again introducing a healthy thrushing. Sorry. Sorry.
Some water.
Yeah. Sorry, excuse me. Going into primary schools, and because obviously the prevention of sort of rotting teeth, etc., that is something that puts a massive burden on the National Health Service with regards to costs. We're also going to double the number of scanners that we have in the UK to speed up diagnosis, and also train more GPs and put a stop to this, you have to ring at 8 o'clock sort of thing in order to get a GP appointment. We're putting on 40,000 more operations and appointments per week. And that will be done very similar to a pilot program that's been running all around the UK, where staff have been doing more overtime and working in evenings and also weekends. And that will have the effect of bringing down the waiting lists that has been at a historical high for far too long. People will say, well, where's the money coming from? Well, that money will come from closing all the loopholes for non-dom status, and also ensuring that the people who can afford to pay more will actually pay more, and that will go into our public services, including the NHS.
Thank you. Vikki?
Yeah, so, to get back to your question, David, frankly, there was never going to be 40 new hospitals, was there? It adds up to all of the other lies that Mr. Johnson told about all sorts of things. There has been some brilliant progress in Dorset with some really good improvements at Dorchester. We've got some great improvements in Bournemouth. We've got the new operating theatres in Poole, and I'm sure he would have told us all about those. But they're not new hospitals. They are refurbs of the hospitals we've already got. So, that's the straightforward answer to that. And even if the letter says that there have been the right number of doctors and nurses employed, what we haven't got is how many people have left the profession during that time, and how many people we've had to bring in from abroad because of all the people who left the country because of Brexit. So, that question is slightly irrelevant. So I'm going to go off tangent, as Candice did, with actually, where what we think is important. Did you know that in Dorset there is a £9 million underspend? in the dental contract alone. Right? There is a £44 million shortfall across the NHS budget for Dorset, and there's £9 million underspend. And instead of that going back into dentistry, which is absolutely desperate in Dorset, it's being swallowed up. So what we believe is really important around dentistry, it goes way beyond toothbrushing, is that actually we need to rethink this dental contract. You know, if you're an electrician and you get invited into a house to change a plug, you don't actually get paid the same amount to rewire the house. And the dental contract doesn't actually pay people the amount of money that they need to be able to cover the work that they're doing. So that's why people are leaving the NHS, because they're not being paid fairly for their work. You've got consultants who are being taxed to the hilt. They're going in, they're not doing any overtime when there's operations needed, because for every operation extra they do, they get paid less. They're often the least paid person in the room because of the amount of tax they're paying, because of the pension system. And then you take the issue of care. You know, for the Lib Dems, we've been really clear that fixing the problem with care is the key to supporting the NHS back to recovery, because there's no point pouring water into a leaky bucket. And if we actually can protect people to stay at home for longer, we can actually support them by paying our care workers more. We put a £2 increase on the minimum wage that you can have in care, and actually supporting our unpaid carers, our family carers, that save the NHS £161 billion a year. Now, the total NHS budget is £185 million a year. So just the people that are doing the caring, that's a doubling if they walked away. If people can stay at home because our carers are valued and respected, they've got a statutory right to respite. Wendy Chamberlain, a Lib Dem MP, brought in the first statutory right to 5 days of carers leave for everybody. We would extend that to proper respite. We would increase the value of the carers allowance, and we would taper when the income that stops at, because people at the moment are paying a lot of money if they inadvertently do half an hour of extra overtime. That would actually allow people to not need to enter hospital as early, and that in itself would ease the pressure on our hospitals. So there's loads more other policies, but Candice has covered a lot around GPs as well, but hopefully that's given you a bit of a flavour of that different side of the coin.
Thanks, Vikki. Over to Ben.
Yeah, I think the original question is something we all know was probably not very true when it was said. They've closed more hospitals than they've opened. Ones they've claimed are new hospitals are just refurbs, as Vikki said. And one of the reasons the hospitals are struggling is because of the closing of the local hospitals. The little satellite hospitals, you can look at the one, Shaftesbury got closed down, I believe. Christchurch doesn't have a hospital anymore. One in Swanage has been deactivated. There's another one in Poole that's been closed recently. These centres help take the strain off the main hospitals. And as great as the new operating theatres are in Poole, we're losing the A&E, which means people who live in Wimborne and Wareham will have longer time so they get to see an emergency. And although Swanage is slightly outside of this constituency, people in Swanage have lost their golden hour because they cannot get to Dorchester or Bournemouth in under an hour. So I was in part of the large protests around the closing of Poole mainly because those people in Swanage were losing their golden hour. When it comes to more general NHS, I think the Green Party supports junior doctors in the current pay dispute. I think, again, removing the cost of education for those wanting to enter the industry will make a massive difference. And increasing pay gives people more worth in what they're doing and makes it better all round. One thing I think is very important is our commitment to giving free school meals to all primary school students, because that way we know people are getting a healthier start. A lot of problems in the NHS is paying for avoidable disease and issues that with people who are fed correctly, people had healthier lifestyles, I think that would make a very big difference, because you wouldn't have the strain of an unhealthy population falling on the NHS. And we've got plenty of policies, including the free school meals, that will hopefully balance that and make it a better situation.
Thank you. David, what would Michael have said?
Is the microphone on?
Take your seat.
I'll come this side because I am... No, I'd better be in front of it. Yes, so I asked the three questions because to me, they are broken promises. And this is the 2-paragraph answer I received. To answer your questions, the biggest hospital building programme in a generation will help protect the NHS long into the future. And the government is already delivering on this vital manifesto commitment. The government has committed to build 40 new hospitals by 2030 and to upgrade more than 70 hospitals. Work is being supported in these projects through 3.7 billion for 4 years, up to 2024-25 of government funding. Latest data for September 2023 shows that there are over 1.3 million full-time equivalent members of staff working in NHS trusts and commissioning bodies in England. This is over 68,900 more people compared to September 2022, which represents an increase of 5.6%. As of April 2023, 500 more full-time equivalent doctors were working in general practice compared with a year ago, and they continue to deliver more face-to-face appointments. I leave it there. I have nothing more to say.
So using our roving mic, would anyone like to, still on this sort of topic of NHS, thank you, David. Anyone else? Otherwise we can move on. Oh, yeah.
I'm mildly partial working in the NHS. There may be more people working. Most of us are working part-time after suffering from burnout, and it's as much as we can do. I'm very grateful for most of the parties here, sorry Ben, agreeing to more scanners. However, scanners don't run themselves. And with 3 years to train a radiographer, 5 years to train a medical physicist, you're going to need more of those, and there's nothing in the manifestos that says anything about staff. If we don't start early, we are going to miss and have scanners standing still and longer waiting lists. Thanks.
Point well made, thank you. Anyone else like to make comments or questions? Yeah.
Evening. Candice mentioned 40,000 more operations which are going to go on. Can you put that number into context? Because I have no idea whether that's a significant number or, compared to the total number of operations, totally insignificant. Numbers without relevance are meaningless.
I'll let the panel just hold that thought while we get some more comments.
I'm probably like many of you who've been told by your NHS dentist that I'm no longer going to be served by the NHS but going to have to go private. Now I've heard from Labour's manifesto that their initial thing is to tackle children with dentistry, but I'd like to know what other parties are going to do.
Still on the top of NHS. Anyone like to? Anything? On your right.
Sorry. Hi, I like Doctor Who, and what Michael Tomlinson said was as much fantasy as you could ever find in an episode of Doctor Who. We live in a country where the average life expectancy is decreasing. We live in a country where children are shorter than they were in 2012. This is because of the cuts that have been put by this government on the population. And it is criminal to think that we can carry on like this. We need to see significant change, and we need to see it very, very soon.
Thank you. Just one more, and then we'll let the panel respond next.
Yeah, coming back to the point on scanners, I was told some years ago that the scanner at Poole Hospital actually operates 24 hours, and that I actually had scans, and I used to go in the evening and have them, because it costs less money to keep it running 24 hours a day than it does to switch it off and start it up again the next day. So what the gentleman said is quite right. It's not the scanners we need, it's the staff to run them.
Okay, Ben, would you like to pick up some of what you've heard?
I think the need for staff is quite important. And I do agree that having equipment without staff is it's a bit pointless. You can have a £500 pair of rugby boots, and if you've got no player to fill them, you can't play rugby. And it's very similar. If you've got all the equipment in the world, you can't use it if you don't have the trained staff. I think, without harping on about changing the education system again, I think that's really important, because we can't train people if they don't feel they can afford to go through the university that they need to get trained. I think with the NHS as a whole, the Green Party is the only party that's been quite honest about the sort of size of money that's needed to rectify the situation we're in. For the chronic underfunding we've had, you can say the last 14 years, I'd argue the last 45, simply because I don't think anything's improved since 79 and Thatcher came in. And the Green Party is the only party that has been honest about how they're going to fund that, which is a tax on the wealthiest in society. And when we talk about the wealthiest in society, that's people with wealth of over £1 million, the sort of money that the average person never sees and wouldn't know what to do with if they had it. It's just incomprehensible money, and it's quite easy to for 1% of wealth over £1 million would fund the NHS on a yearly basis, and then more. A great example of how wealth of that level is very different is Jeff Bezos lost half of his value when he got divorced, gave half his money to his wife. He's still the richest man in the world, with billions upon billions of pounds. He can never spend it. So that's quite important. And there was something else I've completely forgotten about, so I do apologise.
We'll share it around. Candice?
Yes, yeah. I mean, just to pick up on the 40,000 appointments, the figure comes from the 2 pilots that were run in the country, where they gave people the opportunity. Nobody was forced to do it, by the way. People were given the opportunity to do overtime at weekends and also in the evenings. So they got the 40,000 figure from that pilot, you know, with regards to how many more appointments they were able to do over that time period.
Can I answer that? Doesn't answer the question. My question was, is 40,000 a large number compared to the number of operations, or is it a very small number?
It's a significant number, and it's also a number that has actually been proven to be achievable through the pilot.
Okay.
Sorry?
Vikki, would you like to have a stab at it?
I'm still not going to answer that question, because that's not my question. I want to just take issue with a couple of other things. So thank you, David, for reading Michael's answer. It was interesting, he talked about 500 more GPs. Well, in Dorset, there's actually 40 less GPs than there were, when the Conservatives came into office. So, they may be somewhere else, but they're not here. So just to answer the question, there was a question about no point having scanners if you haven't got people to do them. You're absolutely spot on. We announced yesterday our plan for cancer, which includes the recruitment of cancer specialist nurses. And there's an £8.4 billion package in our manifesto, which is around health and social care, which will be paid for by the bank taxes and the windfall tax and the tax loopholes. So it's all there and costed. But specifically, there's a few things that would hopefully help those nurses to bring them on board, and that is around restoring the nursing bursaries, because Ben is right to some extent. In an ideal world, wouldn't it be great if everything was free? But we don't live in an ideal world. But there are some areas where we do need to be giving bursaries, particularly with nurses, because many nurses come to nursing later in life and they have got children and it is more difficult. So, nursing bursaries is really, really important. The real things about retention, you said about only being able to work part-time. Well, yes, you're absolutely right. People are burnt out because we clapped for you, but then we never looked after you, which is just shocking. But I'd like to think that actually if we can fix this problem with the strikes and people feel valued, that over time they'll return to more hours. But there's an awful lot of people retiring early or moving into the private sector. So I heard the Reform candidate saying, well, we're just going to give everybody vouchers so they can get their stuff private. Well, where do you think the doctors are coming from to do these private appointments? They're taking time out of their previously full-time contract with the NHS, and they're going, well, I'll work 3 days in the NHS and I'll work 2 days private. Well, they're the same doctors. So if we actually can fix the problem with people train in the NHS because they want to work in the NHS. They only leave the NHS because they feel like it's broken. And it isn't, correct me if I'm wrong, don't think it's all about money. It's partly about money, but it's also about the way you get treated. So, you go into hospital and you see staff being treated like dirt by members of the public. And I think we need to reset our contract with the NHS as residents. We should expect stuff from the NHS, but the NHS should expect fair practice by us. And I do think we've had a real problem with public discourse and the way that the people treat public sector workers, whether they're NHS, whether they're police, whether they're teachers, whether they're councillors and politicians. Public sector workers are not going for the job that pays the most money. They're doing what they believe is right, and they're being treated really badly. And we've got to start restoring that, but we've got to take it one step at a time. So bear with us, because I think there are enough of us that want the NHS to work properly, and I'm just really sad that you've been used as political football for the last few years.
Okay, thanks. Is Simon Kay? Simon.
Evening, everybody. Hope you're well. Follows on a little bit from things that have been touched on just now. So my question is, institutional corruption is the result of public-private partnerships. Do you agree? What's your position on regulatory capture, and what would you do about it?
Just give a second to take that one in. Could you just repeat the question? Because it's quite a meaty one.
Institutional corruption is the result of public-private partnerships. Do you agree? What's your position on regulatory capture, and what would you do about it?
Candice, would you like to start?
Yeah, I mean, the public-private partnerships, I suppose if you're going to link it with to corruption, it depends on how you actually operate within that relationship. If you've got a very clear regulations, if people are monitored and assessed, especially when it comes to the contractual arrangements, making sure everything is above board, then you don't get into a situation where people are being fast-tracked. People are given preferential treatment with regards to contracts. So I think that the public-private partnership can work. It's something that it needs some reform, and it needs to be regulated. and it needs to have the necessary legislation to ensure that people work within that framework. And also transparency. Transparency is extremely important when it comes to contracts. Now, the last part that you tagged on the end, you're probably going to have to educate me on that before I try and answer it a little bit.
Simply, it's the people that run the regulator are captured by private financial gain.
Yeah.
So they can't act independently or on behalf of the people or to the cause to which they were given responsibility for, because they're getting money in the back pocket, which overrides their objective to do what's right.
So that's people, organisations
So the
regulating
regulator
themselves.
is captured
Yeah.
by the private entities or the people that are employed by the regulator, hence your point on transparency. If there was full transparency, we would be able to see who was getting backhanders for what reason, because there's a hell of a lot of those that have happened where, as much as we can say we have regulation, the regulation is captured by those financial forebearers.
Yeah, well, that has to be stamped out completely. The Labour Party will be putting ethics at the centre of everything that we do, for sure.
Vikki.
So that is a very technical question, but I think, I think there are some examples that we can give where I think there is, I don't like using the word corruption, because I think in some cases corruption is a very strong word, but there are some very odd practices. Recently, there was a vote for the Renters Reform Bill, and people who are landlords were allowed to vote on it. Now, in a council, that wouldn't be allowed. We recently, in a BCP council, we recently agreed the sale of some land to the hospital. Somebody who was a nurse in the hospital wasn't allowed to be in the room for the debate, let alone vote. But for some reason that I hope to be able to tell you if I'm elected in a week's time, some reason MPs don't seem to behave in the same way. And it's worse than that, because, we've got water companies that, are regulated by people who are so weak that, they just laugh at them. So I think governance and transparency, and I'm not going to go into the specifics of the specifics you've just said, because I don't know the circumstances, and I think I'd be more than happy to talk to you about it afterwards. But I think we need to restore trust, because people need to feel that the people who are making decisions do not have any personal gain.
This connects to what you were saying about the NHS and contracts.
It is. So I'll give you a local example. The library in Bournemouth was delivered under one of these public-private initiative contracts, and we can't do anything with it. If we wanted to do something different with that library building, we are stuck. And I think, and I'm not breaching anything here because it's in the council's finances, it costs us £1.4 million a year for that public-private contract, stuck in it for another, I think it's 7 years. The council's almost bankrupt, but we are forced to pay this third-party contractor £1.4 million a year, even though we don't have houses for people to live in. That's a barking mad situation. And we have to find a way of creating contracts that are long enough that people can recover their investment. That's reasonable. We're not going to go to a state where everything is built by the state. There's just not enough money. But we can't get to a point where where the balance is too much in favour of the private company. And I think we need to learn from those early, PFI contracts that have gone horribly, horribly wrong. I mean, some of the schools that have been built under PFI and then have got terrible problems with them, and then the company's gone bust. It was the QE school was built, I think, by Carillion or something that went bust, and then they can't fix the school. So, we have to draw a line in the sand. We have to expect more from our politicians, and we have to expect more from the civil servants behind them as well, because there is a question of who really is controlling things, and I've been getting some very worrying comments from people about who really controls what's going on.
Thank you. Ben.
Yeah, I think it's quite clear-cut in some instances that politicians at the highest level shouldn't be backed by any industry or that pays them for consultancy. I'm a big believer that MPs shouldn't have second jobs, apart from qualified doctors, nurses who work in NHS. Any other job shouldn't be allowed, because that creates a conflict of interest.
What about shareholdings, if it's related to things they're involved in? Let's take Rishi and Moderna before.
I think
by one example.
I think if a shareholding is within in a book of shares that you have as part of an investment, that you have no controlling interest in the business, I don't think that's an issue. If you have enough to have a controlling interest in the business, I think that makes a difference. I think, if you have an investment portfolio and it happens to have some shares in a company that you're not quite sure what companies are in your portfolio, as most people's shares aren't, it's not really a problem. But if you have enough shares to have an interest in the business, then I think that is an issue. Because I think you shouldn't have, because the problem is, with all of us, we're only human. And human nature is to be greedy, unfortunately. And when opportunity presents itself, if you think you can get away with it, most people will. Most people won't admit they will. And that's what happens to politicians as much as anybody else. And a great example is the Environment Minister, not the current one, the last one, who was paid by the oil lobby companies. And then they gave new licences for oil fields in the North Sea. That's an obvious conflict of interest, but it's allowed to happen. I'm not a huge fan of PFIs. I don't think they work, because usually it's to build something for public good where somebody needs then to make money out of it. And I don't think you need to make money out of public good, whether it's building a library. Who needs to make money out of running a library? You run the library for the good of the library. You shouldn't have private enterprise in the NHS, because who needs to make money out of someone's ill health? You need to provide a service, and the service should be provided at the best cost that you can gain for it. But there's no marketplace in the NHS. It's an artificial marketplace, because you've got to buy the tablet, the bandages, the scanner you need. You don't need 3 or 4 people to then try and compete who can do the lowest price. And then you get the companies making money off the back of it. No one should be making profit on that sort of stuff. I think that's where they fall over, because private money will only be given to a project if they can make a profit on it. And then that's where the problem comes.
Imagine how much money would be freed up if that was the case.
Simon, thank you so much for your question. Is Karen Gould in the room? Karen, your question, please.
Sorry, I've got a bit of preamble on the beginning. It's just, I feel the problem with politics is the politics and the division. For me, the best work of government tends to be like the cross-party select committees, and people really sort the problems out. I've always lived in safe seats, and I've had to vote tactically, and it always gives me a dilemma because it breaks my heart. So I have to, my heart's one way, my head's another way. Oh, but I like that person. But so what do you do? And so I just never feel like my vote actually matters. And I would like representation. I want to be represented. So, there are good ideas in everybody's manifesto, absolutely. So I think we need to work together. And I also think so many people are put off voting because they think, why should I bother? Nothing's going to change. I think we need change, absolutely. So, what are you going to do? Can you bring about electoral reform, please? Can we have proportional representation? That's what it is. What would you do to try to bring that about, please?
Better start with Vikki on that one.
Well, it's a very simple one, really. Proportional representation, electoral reform runs through everything that we do. We have somebody said to me, I read your manifesto and there seems to be more about electoral reform than there was in anything else. She was 19 years old and she is so excited to be able to vote because she believes that actually the system, there is a system there that we should be proud of, but it's just broken right now. I don't know whether you know this, but when British diplomats have gone off in the last 30 years to help new democracies form, so after the fall of the Iron Curtain, the Eastern Bloc countries, Lithuania, Latvia, all of those countries, had their democracies formed by British diplomats. Guess what? they all got proportional representation. Obviously, we formed the Scottish government and the Welsh government. Guess what? So why is it that England isn't entitled to the same thing? And I was hugely disappointed to hear Keir Starmer yesterday say that he did no longer support PR. Well, I wonder why, because he thinks he's going to get a massive majority. So there's a lot that needs to be done in electoral reform. So firstly, there's proportional representation. I also think we should be giving votes to 16 and 17-year-olds with the relevant education so that they understand. I can see someone shaking their heads. I know plenty of people who are 50, 60, 70 who know nothing about their vote, and we give them the vote. So, you know, let's trust the people who are paying tax, driving on our roads and everything else. But it's beyond that. We need to take the big money out of politics. We need to reform the House of Lords. We need to get rid of police and crime commissioners. I've said that one before. I'm passionate about that. We need to devolve much more to our local areas. We need to bring in more citizens' assemblies and neighbourhood opportunities so people can make decisions at the lowest possible level. You know, we need to rebuild the trust in politics, and we're not going to do that if we keep having this two-party system. And I'm incredibly proud, as I said at the beginning, that we showed through what we did at BCP that you can bring people together from different political parties and work really well together. Because, as Joe Cox said, we have more in common than we have that divides us. And if you look at countries that have PR, yes, they can have their blips, but actually they get things done because they can think about things in the longer term. Because rather than the pendulum swinging from here to here and smashing everything on the way, they do that because they know they've got to work with other people, and we've got to do it. And you're spot on about the select committees. When people say, what's the point of voting for a Lib Dem MP, you're not going to have the Prime Minister. No, but we will get seats on select committees. We will get private members' bills, early day motions. Annette Brooke, when she was the MP, worked with a Labour MP and a Conservative MP to bring forward some brilliant legislation for park homes. That's where the work gets done. It's not in that stupid pantomime that we see on a Wednesday. And I'm really glad that in the last couple of years since COVID, people have started to see the other work, the good work that's being done behind the scenes. And I think we should see more of that and less of the Wednesday lunchtime.
Thank you. Candice?
Well, Joe Cox was a friend and a colleague, and I very much been running my campaign under the Joe Cox Civility Pledge. So you probably won't see or hear me talking that much about the other parties. You know, definitely no personal attacks. Tend to focus very much on the Labour Party policies, what we've achieved in the past, and how we can move forward in the future. The Labour Party is a broad church, and there's definitely a growing number of both MPs and prospective parliamentary candidates who support PR. And yes, you may see during question time on a Wednesday afternoon, there's that battle between the two main parties. But you know, after 27 years in Westminster and working cross-party right across the board, there is a lot of cooperation within Parliament. However, the balance of power shifts quite a lot with regard, you know, depending on which party is in power and how big the majority is. So with regards to influence and what happens behind the scenes, you know, I've been in Parliament, you know, since the 1997 elections. So I've seen what happens to constituencies if their MPs' government is in power, and I've seen what happens to constituencies if their MPs do not belong to the government in power. So yes, there is cooperation. I come from a community development background, so our main focus and my main focus throughout my career has been very much about inclusion and also giving a voice to people who are very often not heard. Thank you.
PR is Green Party policy. Electoral reform is policy. We equally think that 16, 17-year-olds should have the vote. The majority of them are educated to a level they understand what they're doing. I think it's a misnomer to say that children at 16, 17 don't understand. You'll probably find most classrooms of children that age know more than the general public do of what's going on in politics, because they're closer to it because they're studying it. We would go further with reforms to the Lords as well. The Lords, as an elected body, is archaic in its own sense, as most of Westminster is. The way things work there is quite archaic. It desperate need of modernisation. One thing I think that definitely holds back local MPs to able to help their constituents, to make you feel like your vote counts, even if you do vote for whoever is the constituent, is the party whip system. Because most people I know have gone into politics going to change the world and make it a better place. There's very rarely somebody who goes in for their own self reasons. Most people go because they want to change the world and make it better. We don't always agree what better is, but they want to see their own version of better. But the whip system means that people can't vote with their conscience. So you could have a really good local MP. You may not have voted for them, but you might like them, and they could be really good at defending what needs to be done and protecting the local community. But if they're whipped into voting against it, they will. And they have to. One good thing about the Green Party is we don't have a whip system. So we can always vote with our conscience, whether it be local council or whether it be at national level. As Caroline Lucas did a few times as the only Green MP, went against party policy to what she thought was best. And I think that bravery is what MPs need to have more of, to really be who they want to be and not get corrupted by the archaic systems of Westminster. And only proportional representation gives that, because you cannot have a safe seat in that. And we've seen locally, all 9 Dorset MPs are Conservatives, and all but one seat is a safe Tory seat. This is the only one that's not a safe Tory seat, arguably, because it's the one that's changed hands recently and is likely to do again. And that doesn't make for good politics, because it leaves no accountability. So yeah, PR is the only thing that I think will change things, and an elected Lords would make a massive difference as well, a huge thing.
Thank you, and thanks, Karen, for your question. I want to give gentleman on the first front row there.
There is massive public support for proportional representation, well over 50%, I believe, from opinion surveys. So, therefore, I'd like to ask Candice, as a Labour representative, to tell us exactly where she stands on this, and does she take the view that it appears Keir Starmer takes, that because you're going to pile up a big majority with first past the post, therefore you're going to sit on your hands and do nothing about it and leave the situation to get worse, actually, in terms of representation in this country? The situation will get worse because a big majority will not be a good solution for inter-party cooperation, which you say is what you are seeking.
Candice, would you like to respond to that?
Yeah, I mean, I came into politics, very much to get involved at a grassroots level, as it were. I mean, I have people who come and speak to me about the struggles that they're having in everyday life. So the means by which I personally feel that I can change something was, to get involved in politics. The overriding, as far as my sort of personal opinion, my sort of focus at the moment is to return a Labour Party government in order to help the people who speak to me on a daily basis, about their struggles. And in some instances, my personal opinion has to be put aside because, I want a Labour government, and I want the changes that will help the people that I know on a ground level.
Thanks. Andy, we've got 4 people with hands up. Let's just get them all to say their piece. Michael Lesser.
Please let's not assume PR is the panacea. It's not. If you look at examples of where PR has worked, is in existence, Italy, since the Second World War, and the instability within the Italian government as a result. If you look at Israel, which has PR system, the instability and constant coalition building there. And if we had PR now, the Reform Party would have 100 seats. Would we like that?
Leave that one hanging. We've got 2 more questions down here.
Hi. I just wanted to ask a quick question, mainly to Vikki, because you mentioned making it legal for 16-year-olds to vote, and that does sound good, but would you then make it like a legal requirement for learning about politics to be part of the curriculum in school? Because currently we learn nothing about politics other than the fact that we're a democracy, and we're lucky to be.
Do you want to take
the other?
Just a question about PR. So if each party even won a set number of seats, would they have a list of people to tick off? And then again, people on those lists might not be representative of the local area. You might have someone from Manchester representing down here for whatever reason. So how would you prevent that?
Until our voting systems changes, what's your views on tactical voting?
Oh, thank you. Yeah. And just one more at the top, and then we're going to respond to some of those.
Sorry, quite a lot of my question has already been asked by the lovely lady in front of me, but I'm 17, and I was just wondering what you would do to sort of increase political education and political activism in younger people, and if you had any methods for that.
Some great questions. Okay, let's start with Vikki.
Yeah, sure. So I think you're absolutely... Let's start with the votes at 16, because I completely understand your point. You know, not all schools actually do offer a PSHE programme that includes good political education. Mr. Mead, I hope you have a good one.
Better.
But actually, you know, you could say the same of 18-year-olds, because very few, unless you choose to do politics at A-level, we're letting 18-year-olds vote. But then what about 21-year-olds who left school a few years ago and never had it? What about 50-year-olds who've never been educated? And what about 75, 80-year-olds who only vote for what their parents or husband or family have always done? So I think as a country, we need to take a little bit more responsibility for the choices that we make, and almost all of us have got one of these. So there is a lot of information out there that people can educate themselves on. I think is that the classic thing of no taxation without representation. You know, if you're being taxed at 16, which you are, if you're driving a car, you've got the right to do all sorts of other things which are political decisions. There's no reason why you shouldn't have the right to vote at 16. Doesn't mean you have to vote. I'm not a fan of the Australian system where everybody has to vote. I think that's, you know, you should have the right to not vote if you don't want to vote. But if you didn't feel ready at 16, that's fine. I speak to 18 and 19 and 20-year-olds who say, I'm not going to vote because I don't think I know enough. And I respect that view, although I say, let's get you educated to do it. So I think you can educate yourself there, but schools do have a responsibility. On the PR question, what about reform? You're absolutely right, sir. But I would argue that if we had a decent system of proportional representation, we might not be in this mess in the first place, because I think reform is a response to not being heard. And if at the moment, 15% of people feel very strongly that their voice isn't being heard, then we need to hear that voice, and we need to hear it in a controlled and safe and democratic way. And in the same way as we had UKIP councillors, well, we had a UKIP councillor in BCP Council. She's not here, is she? She wasn't very good, because she got elected on a platform and then she didn't know what to do with it. And we saw what happened with Nigel Farage when he went to Europe. He never turned up. So, you know, I think you have to let these things happen. And you've given some examples of unstable PR systems, but there are equally many systems of stable PR. And the final question is around the local thing. If you look at how they do it, there's lots of different types of PR. But if you look at what they do in Scotland, where you have half constituency MPs and half list MPs, what it allows you to do is, so in Dorset we have 8 constituencies. So let's pick a number. Let's say there was actually 4 constituencies for Dorset. So you'd have 4 of your MPs would represent the 4 parts of Dorset, and the other 4 would be from a list based upon the proportionality. And that allows there to be a local connection, but it also allows you might have some brilliant people who are like the top 20 green people around the country. You want the best, don't you? You don't want the one that just happens to live in your area. Why would you want to miss out on someone who everyone agrees is a superstar in the making, but they happen to live in the wrong place? But on the list, they get the chance to do that. So I think that's a great system. But you know what? There's got to be a way of making it better, because this system isn't working for anyone. And on tactical voting, of course I support tactical voting. Why wouldn't I? But you know what? I equally say to people at the door, you should be able to vote with your head and your heart. And if people vote tactically here, then, you know, it will be beneficial to me. But then you've got to earn the right once you've actually been voted in, and you've then got to win that vote the second time to repay people for that trust.
Okay, thank you much. We've got time for one more question this evening. So if it's perhaps on a completely different topic, that would be great. Would you like to raise your hand? If you wouldn't mind coming to the front, sir.
Right, the question I would like to ask, because you've all been out door knocking, what's the most important issue that residents have raised with each of you on the doorstep, and how are you and your party going to deal with it?
Thank you very much. Ben?
I'm going to be perfectly honest, I haven't done as much door knocking as these two. Most of my campaign has been online, simply because the Green Party doesn't have the funds to allow me to not have to work through the whole thing, hence why I was a little late today. I was up in Birmingham working. But I've had a lot of response online, and I have spoken to people in the street, and you know, the two biggest things we find is cost of living crisis. People are really struggling, and they don't quite understand. Some people understand why, some people don't. And I think it's not an easy fix, but there's definitely political decisions that have made it worse that could have made it better. And the other side is the NHS, which we've spoken about already tonight. Really, people are worried, and people have got a right to be worried, I think, as well, because what we don't address is that we are an ageing population. People are living longer, and it's great, because you get, instead of getting 2, maybe 3 generations of families, you get 4 or 5 generations of family. People are living well. My grandmother lived into her 90s up to a couple of years ago. And that's brilliant. But our systems, we haven't quite caught up with that yet, of how we deal with it. And that's something which I think we need to address as a community, of how we look after people who, as they get older, how we use the NHS, how we use the care system. And it's a very complex issue. The only other thing that people do mention to me, because we're quite open on it in the Green Party, is peace and wars around the world, not just Gaza, which is the focal point of a lot of Green campaigns at the moment, but in Ukraine, in the Yemen, in Sudan. Locally, we have a lot of businesses that are involved in weapon and aerospace industries. And as a country, we supply weapons to every conflict in the world. And if we're going to have a safer, greener world, we need to end these conflicts. And peace is there is never a winner in those sorts of things. And, you know, I probably see more of that because of the Green Party stance. But I think it's quite important as well that we have to be honest about, if we weren't making weapons locally, they wouldn't be dropped in Yemen or in Sudan, and there wouldn't be innocent children being killed by it.
Candice?
I mean, I would say definitely the cost of living and the NHS is the two things that people speak to me most about. With regards to the cost of living, it's the fuel bills and, being in fuel poverty. That's one of the big things that people mention and talk about. And the Labour Party have got policies, and we're sort of looking very much into ensuring that the bills are low and that they stay low. Great British Energy will be launched, and we'll be actually providing our own clean energy in the UK and not having to rely so much on the energy that that comes and the utilities that come from other countries, because obviously that is something that sort of it sort of made the bills and the cost of our energy go up a lot because of the conflicts that are going on around the world. So we're going to take back control of our utilities in the UK, and using the tax that's raised, the new taxes that will be raised in order to pay for that. We've spoken about the NHS already, and also the clean water. That is something that a lot of people speak to me about. And the Labour Party will ensure that the water companies provide clean water, and if they don't, they will be sanctioned. And that is something that our county has been affected a lot by the spillages and the issue that we have with sewage.
Okay. Vikki, what are they saying to you on the doorstep?
Yeah, so obviously those things are all being talked about. I suppose it depends on who you're talking to. I've talked to tens of thousands of people, and the things that are coming up that haven't already been mentioned, the environment is coming up a lot. And what I'm really pleased about is the environment is coming up across the generations. There are many, many people who are worried about the world that their grandchildren are inheriting. There are many, many young people who are absolutely furious with people who've gone before for not doing enough. So that is actually cross-generational. We are seeing a lot of people, and the water is usually the catalyst for that, because it's very obvious. But it's beyond that. It is the weather issues that we're seeing, the climate change issues we're seeing, and the fact that people are just so worried about the future and where it's going. So that is coming up a huge amount. The other thing that is coming up is housing. And I'm hesitating to say this because I'm sure there are people here who are going to go, we don't want any housing around here. But you know what? People recognise that we have not got enough places for our young people to live, for our nurses to live. We haven't got social homes. And it is coming up more and more and more with people saying, a lady today said to me, my son has to live in Plymouth. He wants to live here, but he can't afford to come back. And because we haven't done the right thing over the years in building the right homes in the right places, we've got a situation now where the prices are out of control. We're now building everywhere, which is upsetting everybody. And actually, we're upsetting people in the wrong way. So, we've got to get a grip of housing. We have to explain to people that we need more homes here, but we need to get zero carbon homes, and they need to be with the consent of communities, and they need to be with the right infrastructure in place. And the only way you can do that is to do it by updating the planning system. And it is good to see that Labour Party have got some great ideas about updating the planning system, because the planning system's really got to say to a community, look, we've all got to take some housing. You help us understand where that needs to be, because actually we don't want to impose housing in the wrong place, but the housing has got to be for people to live in and not for people to use as a second home or an Airbnb. And at the moment, the laws are not there to actually enable local councils and local authorities to actually put those things in place. So housing is come up a lot more, and where I thought it was going to be
a lot of please don't do any building. It's actually been, oh my goodness, we have a housing crisis. And that's actually, I'm much more optimistic than I thought I was going to be a month ago, because I'm actually seeing a lot more compassion from people at their doorsteps who are worried about the future for their kids and their grandchildren from housing and environment. So I'm actually feeling quite positive.
Okay. Folks, it's been a really interesting evening. I'd like to thank our panellists for giving such authentic, genuine answers. That's very welcome. Thank you for your very well-informed questions. I'd like to thank Adrian, Andy, Johnny and Ben who've done all this of the technical side of tonight. Much appreciated. And thank you all for coming. If you are interested, I think there is another Hustings on Monday at QE. And apparently Michael Tomlinson is going to be there. So there we go. Thank you ever so much for coming, folks. Have a safe journey home.